So NSAIDs are non-steroidal anti-inflammatory drugs, which are all the anti-inflammatories. Anti-inflammatory drugs work to reduce inflammation. So Dean's question is absolutely spot on, which is that if we want to reduce inflammation, you can use non-specific treatments, which would reduce inflammation from all sources. Those are the anti-inflammatory drugs. And anti-inflammatory drugs which came out with a hiss and a roar probably 30 years ago, and were used for everything plus the kitchen sink. Over the years, we found that, in fact, they're a real two-edged sword, that especially the old ones can increase the incidence of ulcers and may increase large gut problems, may cause kidney function to change, may affect your liver, may put you into heart failure, may increase the risk of actually heart attacks. So there are a whole raft of side effects that occur with the non-steroidal anti-inflammatory drugs, although they are moderately effective, and some of them are quite effective at reducing inflammation from any cause. So the other medications that I mentioned, which are capsaicin, does not have any of the big side effects of anti-inflammatory drugs. It has its own side effect, which is that it burns. It is locally irritating. There are not a lot of other side effects, and the other problem, which is that, as with everything, it has incredibly variable effectiveness. And the third side effect, the third thing, which is really difficult about it, is that you keep rubbing the stuff on, and you have to wait 4 to 6 weeks before anything happens. So that all of those are negatives. The positives are that its effect is local. I suppose that's a positive and a negative, but that its effects are local, and that if you can tolerate it, it either works or it doesn't. Or if it works, at the end of it, you think, wow, was that worth all the effort? Or, my God, that's brilliant. And it's quite unpredictable. Clonidine, which blocks the effect of adrenaline and noradrenaline in the body, so it reduces the overaction of your autonomic system. It helps blood flow into an area, so into, say, a limb. So with Crips, which is cold and pale and sweaty, if you block the overaction, the overproduction of adrenaline into the area, you will increase blood flow. The vessels themselves will allow more blood to run through. The hand will warm up. You'll feel much more comfortable. And it does reduce the neurogenic inflammation that's going on in the area. Its side effects have to do with the fact that it causes vessels to dilate. So it may drop your blood pressure. There are not a lot of other major side effects with it, and especially if you're using it as a patch, because the patch just has a very slow, regular production of the substances. And of course, its major problem, which is with the patch, is that you can react to it. So your skin becomes itchy, and then it gets blistered, and then you just can't use it. And your body is, and this is a side effect which is quite a limiting side effect, because there are no creams or anything that you can do to reduce that inflammation. So you keep moving the patch around, and if you can tolerate it and it works, it can be absolutely amazing. Probably 10 to 15% of people will react to the patch, and its effect is mainly local. So you're treating a local area of inflammation. The Botox has its own raft of problems, but they're all quite different from a non-inflammatory, from anti-inflammatories. Statin, again, has whole raft of its own, but they're all different. And one of the problems with statins is that it, in its own right, may cause significant chronic muscle pain, and all the way through to the statins, which are the substances used for to lower cholesterol, all the way through to this awful condition where your muscles actually almost liquefy, and you have incredible, it's called rhabdomyolysis, which occurs in one in so many 100,000 people, but is completely life transforming. So such that so statins, although they reduce neurogenic inflammation, may in their own right cause muscle damage and chronic muscle pain. So as with everything, the medications, it's always, you look at it and you say, well, how much does it give me? How much does it take away from me? What's the balance? And to me, it needs to be giving heaps more than it takes away for you to continue using it.